Okay. Morning, everyone. I'm Duncan Shrubsole. I'm Chief Exec of St Martin in the Fields charity. Delighted you could all join us today, whether you've squeezed it in between a shift or on a shift or taking some time for some well-being and a chance to connect. We're delighted you could all join us today. Please, you can use the chat section to introduce yourselves, say who you are, connect to people. The Q&A sections, please keep for asking questions throughout the day. Delighted that we've got people joining us from across the UK. In total, over 700 people signed up for different sessions from a whole range of places and workforces, all helping to tackle and resolve homelessness. So, our theme for today is strength in community, because what we want to do is bring people together, a chance to share that unique and completely valuable role it is to be on the front line of helping to tackle and resolve homelessness, to come together in a community and show the strength of what we achieve individually and collectively. So, a bit of housekeeping. So in terms of today's event, you can join for one session or the whole day. We'd love you to join for the whole day, but we appreciate that's not always possible. All sessions are being recorded as webinars and they will be shared afterwards via our website. So that means if you really loved a session and you want to go back and see a bit more about what happened, then you can. Or if you missed a session, you can go back and see it, or you can tell your colleagues, your friends, your family, and they can log in afterwards and see what was discussed. Throughout the day, please get involved. This is online, but it's very much to be interactive and engaging. So you can share your comments via the chat, and lots of people are already introducing themselves, which is brilliant. And you can share any questions via the Q&A. Please do keep that distinction, because it means that we can see the questions and then respond to them. If you start chatting in the Q&A box, it all gets a bit complicated. You can also join the conversation online, whether you're still on X or Instagram, Facebook or LinkedIn, and use the hashtags Frontline Network or Strength in Community. Also, do check out, if you don't know about it, our website, frontlinenetwork.org.uk, where all the material for this conference will be, and the whole host of resources to support you as frontline workers today, tomorrow, and on an ongoing basis. This conference is online because you told us that that's what you liked, as a way to interact, to fit in with schedules, not have to have travel. But as I said, we want this to be interactive and engaging, and hopefully you'll be so. Obviously, with all things, there'll be an evaluation form afterwards. So do tell us what worked, what you liked, what we could do better or differently, because we've done these conferences for several years, but we always want to be responsive and really focused on what you need to help you. So this is our schedule this morning. So we're doing a welcome session. We've got a great roundtable discussion, bringing together voices and perspectives from across the UK. Got a break. Wellbeing is really important. So if you do need to go and grab your emails, grab a tea or coffee, look at your emails, grab a tea or coffee, please do. But do remember to come back. We've got 4 parallel sessions, which you hopefully have signed up for. And remember, if the other ones you're interested in, you can watch them afterwards. So accommodation for work, youth homelessness, drug trends and harm reduction, and migrant homelessness. Got another short break, and then in the afternoon, we have a really key wellbeing roundtable, chance to reflect and some hot tips around wellbeing. Another break, and then 4 sessions, 2 on women's homelessness, 1 on LGBTQ homelessness, and 1 on tools for co-production. And then we aim to finish. Okay, so we said we wanted this to be interactive. So you're on your laptops, but hopefully you might have a phone handy, and we want to get you to share some insights and thoughts on how you're feeling on menti.com. So you can either use the scan the QR code, or you can enter the code. So go to menti.com and enter this code 4836 6956. So go to menti.com, enter 4836 6956. Just give you all a second or two to do that. Okay, hopefully you're on. And a nice question to kick us off. Where are you in the UK? I think this map is going to then magically populate. Look at that, Northern Ireland was in there first. Got some good Central Belt in Scotland. Good spread now. Every region of England coming in there. Really good. Just need a bit of the bit of far East Anglia, and we're kind of and the top of Scotland, and we've covered everywhere. What's really important is just recognizing, and one thing that we're really passionate about at St Martin in the Fields is understanding the picture right across the UK. Homelessness and tackling homelessness is not just a London issue, it's not just a big city issue, it's not just the capitals of Cardiff, Belfast, or Edinburgh. It is an issue right across every town, every rural area, right across the UK. So there we go. That was question number one. You're all warmed up. Question two, this gets a bit more challenging. What are your hopes for the day? So don't need any mini essays, just a couple of words each. How are you feeling? What are your hopes? What are you hoping to get out of the day? Do share, please. Brilliant. Developing word cloud. Lots of keenness for learning, for knowledge, for networking, for connecting, for understanding. Bit of inspiring, learning more about issues. Bit of hope in there. Information. People talking about feeling stressed, but lots of wanting more knowledge, new perspectives. Pinging up there on the chat, bit of validation, resetting, learning something new. Great stuff. Well, we hope we can deliver that for you. You've set the bar. Okay. Great. So I think one thing that's really important, we're going to talk about challenges, we're going to talk about issues, but also we know that so many frontline workers, you do your role because you love it and you're passionate about it and you're committed. But so thinking positively, what do you like most about your role? Great stuff. Making a difference, helping people, helping others. Change, outcomes, fighting injustice, flexibility, supporting others. Good bit of influencing policies, a bit of supporting particular groups, like supporting women or young people. Job satisfaction. Being informed, empowering engagement, lots of really positive stuff. Bit of systems change, community work, changing lives. But key thing is that making a difference. Okay, brilliant. So there we go. Thank you very much. I was reflecting on my way in that I've been at St Martin in the Fields charity a year today, but in the homelessness sector 20 years. Many of you will be here longer or less time. But I started the homelessness sector in 2005 for Crisis. Professionally, I've been a volunteer before, and I still remember the two frontline workers who I met on my first day, Paul and Laura, and what they did day in, day out. They did it very differently, different styles. One was kind of good cop, one was a bit tough love, but the way that they interacted and worked to engage and support people was so critical to the lives changed. And I know that you know that every day, but it's really fundamental that we start with that. If you talk to every homeless person, they will say yes. The person who's experienced homelessness, yes, a house, services, they all helped, but it was somebody, it was that person, that named person who stood by me, made a difference and supported me that was key. And that's what we at St Martin in the Fields charity want to value, champion and support you as frontline workers in your day-to-day work. So to kick off today, thank you very much for sharing by Mentimeter. Continue to put thoughts in the chat. You've got a little presentation from me. I'm going to kind of set the scene a bit about what we do at St Martin in the Fields charity, a bit about the external context that we're facing, and a bit about what you've told us are the issues facing you as frontline workers. And then we're going to go into the roundtable discussion with my excellent colleagues, Michelle, Kate, Katie, and Nicola from across the UK, who will reflect on some of what we've talked about and also take your questions. So, a bit from us at St Martin in the Fields charity. Some of you might know as well. Some of you might be like, this is the first time you ever come across us. So our mission is that everyone has a safe place to call home and the support they need to keep it. And our focus is on three areas. First of all, helping individuals. Secondly, supporting frontline workers. And thirdly, tackling some key issues. So in terms of helping individuals, for those who don't know, we provide a grants program that will work with supporting frontline workers, helping you as frontline workers to cover the costs of moving someone into accommodation. So you awarded nearly 5,000 grants last year, helping over 7,000 people. Do look at it on our website, and if we could help you meet the costs of a deposit or rent in advance, then we'd love to do so. Secondly, and what we're focused on today, is supporting frontline workers, championing your role, your value, providing support. And thirdly, we gain insights from those two areas of work, and we pick a couple of key issues that we think we need to help develop or test emerging or promising practice. And across those three areas, we do so by providing funding, by seeking to learn from the work that we fund and by bringing together those that we fund, and by seeking to influence the context in which we're operating. So today we're really focused on our work around supporting frontline workers. And key to that is the Frontline Network, which is how we seek to bring together frontline workers, yes, in the voluntary sector, but also we know that colleagues in the public, at public services, local authorities, housing association, health, probation and other sectors are all doing a vital role working on the front line with people experiencing homelessness. And we seek to provide funding, bring people together as a community, and gather together a set of resources to help you do your work, and using those resources to also seek to influence others. So in terms of our local one way we do this is by supporting local frontline networks in Scotland, in Wales, in Northern Ireland, and in parts of the UK, Brighton, Blackpool. We also have a couple of thematic networks working with women in Yorkshire and working across London on migration issues. And you know, we those networks, we appreciate we don't cover all parts of the UK, but there's lots of learning from that, which we seek to share ourselves across our Frontline Network website. Another thing that's really key for us is training. So you will in your jobs hopefully get, you know, the core training, health and safety, safeguarding, things like that. But we think there's a real opportunity to help you deepen your knowledge, gain new experiences and access training that sometimes you aren't able to in your own workplaces. So our training program provides that access to learning and skills opportunities. We do that through, we commission a set of training providers to provide sessions online that you can join. We also work with Homeless Link to subsidise places on the level 3 certificate in providing homelessness services. So that's an in-depth 20-week course to really help you develop in your ways of working, supporting people with lived experience of homelessness. If you want to know more, see our website or do ask Homeless Link, but we try and make the price more affordable for those, particularly from smaller charities and organisations. And we can provide grants of up to £500 for an individual or £1,500 for a group to take part in some training. So just check out the website, frontlinenetwork.org.uk training, and we'd love to help you if you meet our criteria, and we can. So the other thing we seek to do, I said, is to seek to influence on behalf of frontline workers. And key to that is our annual frontline survey. You can see the cover of the survey we did last year, which 1,100 workers right across the UK replied. We've just done our 2025 survey. We're analysing the results at the moment. We've had 1,300 apply, which is fantastic. That kind of graphic on the left there is media coverage that we got around the publishing the Frontline survey from The Independent, from Inside Housing, from the Daily Express, and also that the statistics from that, the issues that you told us about, helped feed into working with colleagues from across the sector, the blue light card becoming eligible for homeless sector workers, and statistics have fed into letters and other things that Homeless Link have done. And on the right is an image of a tweet for me, which is, I think this is really key, is that we were invited to join and work with Homeless Link to gather together some recommendations to develop the homelessness sector workforce, which we shared to feed into the government in England's homelessness strategy. And Rick Henderson of Homeless Link and myself went to a meeting with Rushanara Ali, the homelessness minister, to present the findings of this task group, which had representatives from across the sector as well. And you know, we're going to talk later about the homelessness strategy. We still need to see what comes out of it. But the fact that there was a specific group looking at workforce issues alongside those looking at housing or services was really key, because too often that people have just assumed the workforce will get on and do the job without thinking, what is it you need to support your development, your pay, your retention, your recruitment, and your progression. And so the recommendations that Homeless Link and Kate, who we're going to hear from later, was a part of that, working with ourselves at St Martin the Fields charity, informed by everything that you tell us, was key to say to the government, look, you need to think about workforce issues. It's not a nice to have, it's fundamental to not just helping individuals, but delivering any strategy that wants to tackle homelessness. Okay, so I now want to bring us, having talked a bit about us, just to reflect a bit on the context in which we face. And I think there's a bit, I'm going to talk about the good, the bad, and the ugly of the world in which you and we are all operating. So always good to start positive. Firstly, the good. So the external context we're in. So the good. A year ago, just under a year ago, 11 months ago, we did have a general election and a new UK government came in, prioritising social housing and private rented sector reform. Of course, there are issues and questions about those things, but actually having a government with the Deputy Prime Minister and others who want to prioritise those issues, who do want to build social homes, do want to make the PRS better, is a very welcome step. We also, I've just mentioned it, had a commitment in England to a new homelessness strategy. And the first year of spending and the spending review that happened a couple of weeks ago have maintained and protected spending on homelessness services in terms of the set pots that are there at England level. Of course, in Scotland, Wales and Northern Ireland, there are then Barnett consequentials. But again, it's not necessarily a given that homelessness funding would be protected and even increased in some areas. We also saw in the budget, sorry, not in the budget, in the spending review a couple of weeks ago, a commitment to a new crisis and resilience fund, £1 billion. This replaces the household support funds, which had often been brought in each year, kept saying they were going to end, and then they keep bringing them in. This gives it some long-term commitment, and it will also in England replace the discretionary housing fund. But it does mean that there's funding at local level to help support those in crisis, and there is Barnett consequentials in terms of Scotland, Wales and Northern Ireland. I touched a bit on this before, but I do think there's been more recognition of the role and value of frontline workers. The blue light card expanded in Wales, which Katie Dalton from Cymru Cymru might talk about, has been a task and finish group and a Senate inquiry, which have all highlighted the value of frontline workers. And I talked about the strategy group there's been in England. Also, in Wales, there's new legislation progressing at the moment looking at housing, and the Scottish governments have been doing a series of actions to seek to tackle homelessness. And just a quote there, which is from Prince William, Prince of Wales, which is from when he launched the blue light card expanding to the homelessness sector. But he was talking about, just like our emergency services, you homelessness frontline workers are the people who are there for others when they're in greatest need, providing unconditional care, compassion and humanity. And, you know, it's easy to be cynical, but I do think that recognition from the top, as it were, of the role and value of the work you do is important and isn't something we might necessarily have had in the past. I also mentioned the Deputy Prime Minister before. Angela Rayner was a frontline social services worker, and she also gets that the front line is what matters the most. So that's the good. Now the bad. Right, so, and then the ugly. So in terms of the bad, so we're going to get a new homelessness strategy in England. It's potentially likely to be more limited than it needs to be and more limited than it should be. We also know that local government and charitable funding is still very squeezed. All of you out there running services or trying to get money for services know how tough it is to get money, and not just for your own services, but everybody else's services are under pressure. Huge pressure on probation, mental health, substance misuse. The homelessness sector is constantly having to fill in the gaps when those services that you try and refer people to are just not there. And we know that as frontline workers, you're facing real challenges, as our 2024 survey said, about the cost of living for you and the burnout that you're facing. And now on this day, to get you really cheery, the ugly. The shortage of housing, suitable housing, its affordability is chronic, deep and long lasting. Great plans to build more houses, but that takes time to come on stream and it may be too little too late. And we know that with LHA rates frozen, the private rented sector remains a real struggle. We also see continuing and sometimes deepening public and policy hostility to migrants and asylum seekers. I talked about a general election last year. I don't think any of us had on our first year in government bingo card cut the size and scope of cuts to disability benefits that are being that are on the cards and look like they're going to be introduced. Really deep and damaging to many of the people we support, and also knock-on impacts in terms of carers allowance. And for those of us trying to help people into accommodation, people who are currently on PIP get an exemption from the benefit cap and the LHA, the shared accommodation rate. So that will have real challenges too. Also, that ambition, that energy, that resources that we had around everybody in, yes, it wasn't perfect, but the drive, the partnership working was so key. And sometimes it feels too much like a distant memory rather than something that was actually only 3-4 years ago. And all of us know that homelessness, the lived reality of what we're trying to do, is rising across the UK. So, sorry to be a bit depressing. There are good things, but I think we also need to be aware of those bad and ugly things that we're facing. So, we're now going to move on to just reflecting a bit on what it's like for you, what we know here at St Martin's for you for working on the front line. And so I've got 12 insights that I said we're analysing our 2025 survey. And these are some of the kind of top insights that are coming out. We're going to publish the survey in full in September with both statistics and full analysis. And thank you for those who responded. We had over 5,000 text contributions and we want to do justice to them all. But I'm going to share 12 insights here. You probably won't surprise you, but hopefully it may also reassure you that if you're feeling these, others are feeling them too. So 3 here about housing, that the housing shortage is forcing frontline workers to offer unsuitable or unsafe housing options. You're facing Hobson choices between this bad option and that bad option. The second is rules and gatekeeping are blocking access to housing. So whether that's local authorities asserting more control or the thresholds for accessing services are rising. But again, it's meaning you know there are people you want to help, you cannot help them in the way that you want it to. And the combination of that is that means that some clients effectively have become unhousable. If their needs are such that they don't fit the tight boxes of the rules being set by others, then sadly you're really struggling to be able to house some people at all. And building on that, in terms of other thoughts about housing and services, you're finding blocked move-on pathways are causing gridlock across the system. People are stuck in hostels and supported environments, which often are good, but sometimes are not right for them, particularly that length of time in them. Unmet support needs, people bouncing around between services who aren't getting what they need around health, welfare and immigration, which means they can't get support or move on, or they can't sustain accommodation if they do get into it. The PRS, private rented sector, is now the only option open to most, but we know that that isn't perfect for many people, particularly with high support needs or longer term. It's unaffordable and the quality is not what's needed and the support isn't there. So in terms of the context, what does this mean for you as frontline workers, your workload, your roles and values? peak frontline workers are talking about exhaustion and strain from the unmanageable workloads that you face. This comes out really strongly, role creep. So if in the past you could refer to the citizens' advice down the road, or the drug and alcohol treatment, or a food bank, or mental health support, it wasn't perfect, but you could get help. When those services aren't there, you are thinking, my God, I need to go away and brush up on my benefits advice. I need to know a bit about immigration law. I need to be able to do some kind of basic mental health support. But that means your role is creeping. You are filling the gaps as other services retreat. And at its worst, you can think you can feel like you're having to act against your values, and it's causing moral injury. And we know that it can be really tough, that daily battle. You know what you need to do to help someone. You really want to do it, but you're not able to do it. And we know that the job is getting harder. There's always been funding, sometimes it's too short term or crisis funding, which can create instability. It can be hard for charity to recruit and retain, and services to recruit and retain people. But when the pressures are greater on the system, that short-term funding becomes even more tricky. We know that rising living costs are squeezing you, and the national insurance increase hasn't helped this, because if services looked at their pot for salaries and then they have to take out the national insurance increase, that means it's harder to pay what they want to recruit and retain people. But lastly, yes, you're struggling, but going back to what you shared before, frontline workers still say they love their jobs. You get up in the morning, you do a great job because you want to help people that you see. You want to get alongside them. You want to be the tool that helps them move on with their lives. And that is this hugely powerful thing about the homelessness sector workforce and all of you as individuals. So those are some insights, things that we're capturing. I said we're going to write it up. We will take these messages, as we did before last year, to politicians on the all-party parliamentary group, to ministers, to civil servants. Want to share it at conferences and with the media. But we wanted today to give you some kind of early insights on those issues, to hopefully help you, inform you, and reassure you that if you've shared your response through the survey, what you're saying, you're not alone. So just to finish this section, kind of want to just ask you a couple of questions about how you're feeling. So go back to Mentimeter. There's the instructions again, 4836 6956, menti.com, 4836 6956. And without sounding like a local radio DJ, the question of choice is, how does it feel working on the front line in homelessness right now? You could write a lot, but just kind of one word, please. All the big ones: difficult, stressful. Some really tricky ones: heartbreaking, impossible, demoralizing, demotivating. But also still, and that picks up what I said earlier, rewarding as well is in there, alongside overwhelming, tired, mentally draining, futile even. Never ending. But yeah, I think that those are the kind of words that we would expect, but thank you for sharing. But also hopeful is in there too. So it's that constant battle that you face between a system that isn't working and the desire to make a difference. Okay. So something that would make you feel more supported or valued in your role. So lots about pay, funding, security, but also those things that are equally important. And sometimes they cost money and sometimes they don't. It's about recognition. It's about feeling valued. but you know, being listened to alongside better pay, training, support, long-term funding, space for creativity, proper support, resources, recognized career path, training, progression. But we cannot ignore better pay is standing out right in the middle there. Whatever new words you're adding, it's right central there, that issue about being paid a fair and appropriate wage for the work that you do. Okay, thank you for sharing. And a positive thing that helps you. So one of the things we said, we want to learn and share. So what's something that you do in your day-to-day that you find helpful, and maybe someone else could see it and learn from that? Exercise, kindness, managerial support, reflection, connecting with others, mindfulness, self-well-being, teamwork. There's some great some of these are things you do yourself, like exercise and mindfulness, and lots about with others, celebrating wins, support from peers, gratitude from clients. Collaborative working, hug from the kids. I think we'd all like that, instead of being shouted at in the morning. But yeah, exercise, reflection, good management, and this thing, and this is going to be one of the themes today. Like we talked about pay in the previous thing, but actually giving people a space for exercise, teamwork, and reflection can make a big difference. Doesn't have to cost megabucks, but allowing people that space to connect and get recognition. Okay. And then the last thing to say to finish this segment is one thing you would want to say to government and policymakers. We talked about what you do, but what would you like others to do? What do you, those who are ultimately responsible for the policy and systems and funding that you work within? What do you want? Take action, do better, have a heart, see the raw truth. Listen and act. Lots of listening, be bold, build more, take concern seriously, come and work with us for a day. Open your eyes. Scottish voice there about independence. Co-production. Spend the day in our shoes. There's a lot of kind of walk alongside you as you walk alongside people experiencing homelessness. Sort it out. Make housing affordable and accessible. Think about real lives. Listen to frontline workers. Okay, we are catching all of this, and it will feed into our work and the messages that we take ourselves to ministers, civil servants, MPs, and others. On specialist workers, have an understanding of lived experience, listen and understand. Okay, brilliant. Thank you so much. Thank you for engaging. Keep engaging throughout the day. Hopefully that's given you a bit of a flavour of who we are at St Martin's, the context we're in, and those issues that you told us about as frontline workers. We're now going to reflect on those things that we've shared. I'm going to invite our colleagues and friends from across the UK. So, and magically they're going to turn their screens on. So, we're joined by Katie Dalton, Director at Cymorth Cymru, Michelle Major, Impact Lead at Homeless Network Scotland, Nicola McCrudden, Chief Executive of Homeless Connect in Northern Ireland, and Kate Alaway, Head of National Workforce Development at Homeless Link. I'm going to come to each of them in turn, ask them for initial 2 or 3 minutes to reflect on what they've heard and what they think are the key issues facing the homelessness sector workforce in their respective nation. And then we're going to have an open discussion between ourselves and responding to your Q&A. So do put any questions in the Q&A. I'm going to go to Katie first to give us the perspective from Wales.
Diolch Duncan, diolch yn fawr iawn gwahoddiad. Bore da, good morning everyone. Thank you Duncan for inviting me to be here today. It's lovely to see so many frontline workers engaging in this. I think my reflections on the presentation, and thank you so much to the Frontline Network for continuing to do such an important survey that helps to shape a lot of the representations that we make across the different parts of the UK and to influence some of the policy and legislation. I think my main reflection is that none of this is new, and I feel a huge sense of frustration that nothing has changed substantially enough to make that difference to frontline workers' lives. A couple of weeks ago, went to give evidence alongside Nicola to the COVID-19 inquiry in London. And one of the things that we both spoke about was the importance of the frontline workforce. We were thinking back to those early days of the pandemic and the fear that we all felt about what could happen to people experiencing homelessness, given the health inequalities that people face and the risks that they face. And we reflected on how amazing the frontline homelessness and housing support workforce was during that time, at a time when, you didn't know, well, none of us knew much about how the virus was being spread, what impact it would have on your health, whether you could end up dying. And you all went out there and continued doing such important jobs, and not without, I think, the guarantees at the start that you would get the same recognition that health and social care workers and all of us across the respective nations fought so hard to get you that recognition and to try and make sure that you had the PPE, the statutory sick pay policy, all of the rest of it that you needed. But those early days and weeks, there was no guarantee of that, yet you still went out and did that. And I think, that experience of going to give that evidence to the COVID inquiry made me reflect a lot on how hard we had to fight for your recognition back in 2020. And while I think that has improved somewhat, I think we still have so much more to do. And despite the vital role that you all played during the pandemic, we are still fighting for your recognition, fighting for better pay, better support, better job security. And it frustrates me that we are still in this position. However, all of us around this virtual table are wholly committed to fighting for exactly those things. And I think we'll reflect a lot on those during the discussion today. I think, some of the things that came up in the presentation around systems not working, other public services not playing their part. And, I always pose the question, where would those public services be if the homelessness and housing support workforce didn't exist? And they would be in a significantly worse place because of the incredible work that you all do to pick up the pieces often when other services have failed people or stepped away. And I think in Wales, we've, as Duncan mentioned, we've got a new homelessness bill that was laid before the Senedd, which is our Welsh Parliament, a couple of weeks ago. And that has some really important elements to that bill, which will put legal duties on other public services to cooperate with homelessness, to ask and act if someone has experience of homelessness or is at risk of homelessness. And I think that hopefully will go some way to trying to make sure that other services do play their part, because we know the pressures that you're under, whether you work in the third sector or local government or housing associations, you're under significant pressure. And if other parts of the system intervened earlier, then that would release that pressure on your services. It would release pressure on temporary accommodation. So, there's a lot to do to improve that would have a knock-on impact on your lives. I think the stuff around job security and pay is such a common theme, and it makes me so angry because you're so vital, yet we haven't fixed this problem yet. And I'm sure we'll go into that in more detail over the next hour or so. But I think also those reflections about space, connection and reflection, and I think pay is such a critical part of this, but pay on its own won't solve all the challenges that you're facing, and having some of those other things that enable you to feel supported and valued, that give you that time to reflect and connect, are really, really important. And I think the Frontline network as a whole, and all of the individual networks that run across the different parts of the country, are all vital to providing you with the space to connect with peers. And certainly in Wales, through the Frontline Network Wales, the feedback we get is that frontline workers love being able to have a voice and to influence some of the policy or legislation that we're influencing. But actually that peer support and knowing that there are other people experiencing similar things is really, really important. So, you know, I think that the Frontline Network plays an incredibly important role in providing that space for people to connect and reflect and find that peer support, and really pleased to be part of today. But so much more to do. But I think you'll hear from all of us on this screen that you know, we're all so committed to fighting on behalf of frontline workers in our respective nations, and we will not rest until we make some change happen. Diolch.
Brilliant. Thank you, Katie. And I think that reflection about COVID and the way everybody stepped up, but how it had to be fought for. It didn't just happen. And then that energy dissipated, and now we need to fight again around pay, around recognition, around job security, and around other services. So we're going to go shoot north to Scotland now. And Michelle, please, to give us the perspective from Scotland, please. Thank you.
Thank you, Duncan. Good morning, everyone. Really pleased to be here. I'm an impact lead with Homeless Network Scotland, which is a national membership body for organisations fighting to prevent and address homelessness in Scotland. So just really struck by the responses to the survey that you've outlined there. But similar to Katie, none of it is a massive surprise. I think lots of what frontline workers are reflecting in their responses mirrors the sort of situation in housing and homelessness that we face in Scotland at the moment, where actually, with a bit of hindsight, this is something that we could have seen coming for many, many years. We in Scotland have declared a national housing emergency and have housing emergencies declared locally across 13 local authorities too, which brings, you know, 13 out of 32 doesn't sound massive, but that's more than 50% of our population currently unable to kind of access the housing and homelessness system that they have incredibly strong legal rights to. Stronger than sort of other parts of the UK, in fact, but we're in a situation now where it feels almost, you know, those rights, and I think that's some of the frustration that frontline workers north of the border certainly feel, is that we are aware that we have these incredibly strong rights, but in practice they're becoming sort of nullified by the lack of housing stock available for people. So I think it is absolutely a time for sort of radical action, and to see some stuff that sort of real coming together that happened during the pandemic. That's what we are kind of fighting for up here, is to see that if this is a housing emergency, where's the emergency response? And you frontline workers are the emergency responders in a lot of that situation, and it's incredibly difficult to respond to an emergency where there's no measure of when it's finished. There's no measure of when you've completed it, type thing. So just a sort of solidarity with what people are facing at the moment, but just to say that we're from our point of view, we've just had a new Cabinet Secretary for Housing appointed. We have a housing bill about to go through Parliament and hopefully pass in autumn, which brings in a similar duty to what Wales has about asking and acting to prevent homelessness across different public bodies. So hopefully that will bring a bit of a relief to that sense of other sectors not taking the responsibility that they should. And in line with that, sort of getting ready for that coming in, a big focus of ours is how do we get those other sectors clued up, so that they know what to do, so that they know how to ask, and they know what actions are available for them. We're acutely aware that a lot of these really great policies fail in their implementation. So that's our focus, is to make sure that we don't continue to create incredible legislation that can't be implemented properly, that means that you on the ground, on the front line of homelessness, are then unable to fulfil people's rights the way that we know everyone would like to.
Brilliant. Thanks so much, Michelle. Some really thoughtful perspectives there. I think this point about housing emergency, we often talk about, across the UK, we'll have news crews going to A&Es and see how, people on trolleys and people on chairs, the housing equivalent in A&E, people don't see and they don't report on, and they don't realise that this is happening not just on a Saturday night in winter, this is happening day in, day out. I think your point about also that, in England, we've always looked enviously on the Scotland framework of rights around homelessness from 2012 onwards, but that has to be backed up by services and accommodation to make it make sense. And that thing about how we get other services collectively, but on an individual level through Ask and Act and other measures to mean that they do take their responsibilities and don't just parcel people off and say, well, the homelessness sector will pick up the pieces, which is so often the case. But thank you. So we're now going to shoot west to Northern Ireland and hear from Nicola on how things are feeling there. Thanks,
Yep.
Nick.
Yeah, thanks, Duncan, and thanks again for the presentation. Nothing new, exactly the same scenarios in Northern Ireland here. We're facing very similar circumstances, very challenging funding environments, staff feeling under extreme stress, having, very little options to give to people, which is that kind of chink of light that you have when you're working with individuals or families. You can give them hope, because you know that there will be a home, hopefully coming shortly. I've worked in the sector a very long time. I started in my 20s, and just listening to Michelle and Katie talking, I thought, well, I remember I used to work for Housing Rights for about 21 years in policy, but also used to give advice. And I remember times whenever on a legal basis, you would challenge things like whether or not the temporary accommodation was suitable. That is just not a reality. Nobody is going to be challenging whether or not a placement is suitable. You're lucky if you get a placement. Now, we're fortunate here in the sense that, the Housing Executive has responsibility for homelessness right across the north. And, even while the investigations are going into priority, the first thing they will do is to put you into temporary accommodation. But what we're seeing now is, unfortunately, the way I see it, is a move away from almost strategy around housing first and housing led and all these words we use, rapid rehousing. And what's happening now is we need a larger portfolio of temporary accommodation because there's not enough of it. So, for example, in the voluntary sector hostel temporary accommodation provision, there's a 16% reduction in the numbers being placed just because it's silting up, because there's nowhere people can move on to. We're seeing increased reliance on hotels and B&Bs, which wasn't traditional here. There's about, I think, 5,000 households at the minute in temporary accommodation. That's up 140% since 2019. And a huge squeeze on budgets, and staff in the front line are feeling that. There's a real frustration around not being able to help and support people in the same way and not having the same amount of staff coverage. And in some services, we're seeing 35% turnover in staff. Obviously, employers are having to deal with the national insurance contributions. That can be up to 15% additional cost, and we're not seeing any additional funding coming into the sector. But at the same time, there's significant amounts of money going into the private sector, which is the hotels and B&Bs, where nobody should be in hotels and it should literally be as an emergency. But people are spending longer and longer amount of times in there. They're not getting the right support. And of course, as we all know, very, very complex needs, very challenging behaviour, polysubstance use, mental health, all those issues, all those really complex, and people just aren't being able to get the support that they need. It's very frustrating. And what I say to anybody in the front line is you're amazing. You really are. It's like, it's quite an incredible job that you do. But again, as Katie was saying, and it came up in an earlier comment about validation, government needs to recognise the value of the workforce who work in homelessness and support services. And I'm not saying that nobody does. I think employers do. We certainly do. But it's almost like we need to put our money where our mouth is. We need to invest in our staff in the front line and give them the right training and skills and remuneration and conditions. And I'm sure we'll be coming on to later in terms of the PI-informed environment. I mean, that's where we need to be moving to. I know others have implemented PI and some have done it here, but more trauma-informed. But I do think that there's a challenge here because it's about managing risk as well as looking after your staff and looking after your clients, your customers, the people with lived experience. And from an employer perspective, that can be really challenging. But we certainly think the Frontline Network has brought a huge opportunity here for frontline staff to come together to give them a voice. And I certainly believe in co-production and in co-design along with people with lived experience. And I would like to see more work being done with that PI approach, with that journey hand in hand together. And I think that people on the front line and people with lived experience really have the solutions to some of these issues. But in terms of Northern Ireland, our immediate need is basically more social homes. As we know, they're not going to be built overnight. We've got huge problems here in terms of resourcing, wastewater, with planning issues, with land issues. We know all those issues. But I think we need to be more innovative. And I think at a time when we're just constantly firefighting and in that crisis mode, I'm talking about government and policy and strategy. I think we need to make space and room for innovation because we'll just constantly be firefighting, Duncan. And I think frontline staff have a real role to play in that innovation and in that solutions focused approach.
Thank you, Nicola. Very thoughtful. Just couple of things you mentioned, but one was talk about the importance of co-production. And just to give a bit of a plug, we've got session 8 this afternoon. Is bringing together All In for Change in Scotland with Just Life in Brighton, and it's a session on co-production. If you haven't signed up yet, or you've signed up for another session, you can watch it online later. Do join that session because co-production is really important. A couple of other things that you touched on, the turnover of staff. This isn't unique to the homelessness sector. You look at lots of public services where experienced staff have left and new ones are recruited and they turn over. But particularly is challenging in our sector because so much of what you learn as a frontline homelessness sector worker, there's some practical stuff, but there's all those skills that you learn of how to work with different people, how you engage, how you build people's trust and confidence. That takes time and experience. And when you lose that, it really sets you back as a service. So that issue about retention and development of staff is key. And then generally on this challenge about spending ever more on temporary accommodation, the crisis spend and ever less on the long-term solutions, which is the preventative and long-term services, the social housing we need. Basically, doesn't work very well online, but the graphs are like this. We're spending so much more. It's the same in children's social care. We spend so much more taking kids into care and not on the preventative services that would help them and their families. So there is money there, but it's being spent on the immediate, and we need government help to help us be able to spend it on the long-term solutions that we need. But thank you, Nicola. Really helpful. And we're now going to zoom back across the Irish Sea to England, and delighted to ask Kate to give the perspective from Homeless Link. Thank you.
Thank you, Duncan, and thank you for having me. I just wanted to start just how I was really pleased to see that you'd frame the conference around community. I think there's a real strength if we can see the homelessness workforce as a community, that group of peers that support one another, whether that's formally through reflective practice or mentoring, or informally. And I was quite interested to see in the Mentimeter kind of one of your questions around what helps people. That sense of connection and teamwork came out really strongly. So that for me felt like a really nice place to start. However, like my colleagues in the other nations, the insights you shared do really resonate with what the intelligence that our members are telling us, which are quite challenging to hear, I think, because it can be quite a depressing picture that we're painting. I thought I'd touch on some of the workforce challenges in a bit more detail. And workforce is one of the most pressing issues that we're told about from our members across the country. Roughly 10% of all intelligence that we get through relates to a workforce issue in one way or another. Members talk about the kind of challenge in recruiting staff. I think our latest workforce survey showed something like 61% find it really hard to recruit talented staff, which is really high. And I think since COVID, and we've touched on COVID quite a few times today, but in the last 5 years, that's got harder. They've seen a decrease in candidates with relevant skills, experience, and applicants wanting greater flexibility that's just really hard to provide in frontline services. Finding services can't hire the first time, they're having to go out again and again, and that's then having a knock-on impact on the rest of the team. Or they're being forced to use agency staff, which can mean a lower standard and quality of work. And this all, it kind of impacts on the kind of actual individuals experiencing homelessness. So that's a fairly kind of bleak through picture, I guess. Added to that, we've touched a bit on pay, but the inability of services often to kind of pay competitively makes it really quite challenging. Something that I think came out quite highly in your last workforce survey was also around the challenge around retaining staff and staff burning out. Remember you talking about burnout and bills, and we're still hearing that a lot from services. The kind of short-term nature of funding that we've experienced in England and the uncertainty of future funding is causing people, really skilled staff, to leave the sector. This then causes capacity issues for services, impacts on service delivery. So I think it was 78% of our survey respondents said that they are struggling, their understaffing impacts their ability to deliver a good service, meaning those experiencing homelessness are worse off. This then in turn places greater pressure on staff that are left, causing them to have burnouts or lower morale. And something that's kind of, I think we've already mentioned today, is around why people can't choose to work in the sector. They really want to make a difference. 89% said that was why they chose a career in homelessness, that desire to help people. And again, that came out really strongly in your survey this morning around that helping people, making a difference. That's really, really strong. And yet we're seeing high numbers leaving due to the complexity of the clients they're supporting and the high workload. Added to this are EDI considerations, where staff from minoritized communities or people with lived experience are more affected by poor pay and are less able to endure them. So overall, from my perspective, sadly, it's painting a fairly bleak, quite a difficult picture for the sector. However, I did want to kind of end on a negative note because my colleagues at Homelessness wouldn't like me for that. And I guess I do have hope. You touched on the homelessness strategy that we're expecting in England. And whilst, yes, it may be limited, we as a sector, you as staff within the sector, you have the skills, you have experience, you have the knowledge to add weight to what the government are going to introduce. You really can add to their agenda. We've had insight that we think there's going to be 6 broad chapters to the strategy, one of which is described as the foundations of a better system. And for me, those foundations are the workforce. And I feel the task and finish group that Duncan and I were part of, and the fact that they had such a clear focus on workforce means for the first time, they are also seeing the value of it and seeing it as integral to the homelessness strategy being delivered. Without a good workforce, you can do nothing else. So I do have hope that they are listening to that and that some of that will come through. So I guess it's just, let's not lose that fire in our bellies that we had during Everyone In, that we worked where we worked together, and then kind of regain that sense of community. Because I do think there's so much knowledge and skills and expertise, and such a good bedrock from which we can kind of do more.
Brilliant, Kate. Thank you very much. Just a shout out, if anyone wants to put a question in, do put one in the Q&A. But I think, Kate, where you finished with kind of fire in their bellies and that sense of what are the actions that we can take, I think is really key. And so I'm going to ask, come back around the panel and ask you to give us your top 1 or 2 things that you think are the really key things to focus on to change? We've got a question in from Ed, who says, if we're fighting for frontline workers, who do you feel we are fighting against? Whether you want to describe as fighting against or fighting for and with, or however, but give us a couple of things that you think are really important to kind of change. And just while you're thinking, there's also a question in here about supported housing and getting ready to go back for work, how you balance being in supported housing and working. And that, I'll give you a shout out, session 1 on accommodation for work from Brighton Housing Trust is looking at precisely that issue. So if you want to sign up for that, please do. But I'm going to come to the panel. So what are the key couple of changes that you think? And I'm going to go to Michelle first in Scotland.
Thanks, Duncan. I think that's a really great question, actually. What is it that can really make that difference for frontline workers? And from my perspective, I totally agree that, you know, the pay isn't everything, but it is a lot of things, and it's a big thing. And at the end of the day, these are jobs and they're hard jobs, and it's important that they're paid properly. So one of the things that I think could really make a difference, and this is something that in Scotland has a really big impact, is just about how services are commissioned. There is that kind of insecurity that a lot of people feel comes from being on a contract that's maybe a year or 18 months or 2 years, and those are actually choices that are made. Those aren't things that just happen or that have to happen. And lots of other services are not, outside of housing and homelessness, are not commissioned short term. So for me, there's real potential. We've just been involved in actually the sort of redesign and an ethical commissioning process for homelessness outreach services in Glasgow, which will see a sort of long-term contract for outreach, and that had people with lived experience and frontline workers heavily involved in the design process. So that everything around job security and pay, and actually probably training and support, for me, roots right back to how services are commissioned. Which of course comes back to sort of central government, or for us the Scottish government, and sort of is impacted of course by what happens in Westminster as well. But that's really important. And in terms of the other thing that struck me that would make a difference, I think in a more immediate term, while people like us do the sort of behind the scenes advocating for things like longer term commissioning cycles and more ethical commissioning, would be, in my opinion, people being able to exercise the autonomy that they absolutely should have in the roles that they have. So we talk so much about things being relational and the importance of that healthy, trusting relationship to sort of demonstrate how to live a good life as a member of society happily. And yet I just a couple of weeks ago was speaking to a whole bunch of frontline workers who talked about having funds available to take the people that they support out for a coffee, but that funding doesn't cover the workers' coffee as well. And simple little things like that. I just think that's absolutely insane. How is that sort of developing a kind of natural, healthy dynamic in a relationship where people can feel trusted and normal, where one half of that relationship is either going to be out of pocket or is going to sit awkwardly without a coffee while they're trying to build a relationship with someone. So things like that maybe haven't been considered in the terms of the kind of impact that they have on a cumulative basis. Having that as a one-off, maybe not a big deal, but that being the sort of thing that you experience week in, week out when you're already on quite low pay, is incredibly difficult and actually erodes the relationship that people build with the people that they support as well. So big picture, the way services are commissioned, but actually in the immediate term, the things that organisations have in place that maybe they haven't considered before that are impacting wellbeing and how relationships are formed.
Michelle, you have got us off to a flying start there with some brilliant suggestions. Well, today we want practical suggestions, so all go and check out the ethical commissioning process for outreach services in Glasgow. Because I think you're completely right on commissioning. It isn't just the money in the pot. It's the time period, it's the stability, it's recognising the expertise that's already there, which enables people to recruit and retain. I think there's also, Ed's come up with a follow-up, which is also, yes, central government, but there are other responsibilities too. And one of those is in commissioning. It takes two to tango. And sometimes there are parts of the sector who engage in quite sharp commissioning practices, have done in the past, where they've recognised that you could maybe reduce, swap some workers around and have some cheaper workers in order to win the contract. It's happening less than it used to, but I do think we have a responsibility too. And I think your point about some of the small little things as well is really key. They're actually, having a expenses policy, which means if you're a frontline worker that does go and meet someone in a cafe, you can claim back for your coffee. It's easy. There's some of those group activities. We've seen some fantastic examples. Kay and I were both judging the Homeless Link Excellence Awards the other week, and there was a great example of an organisation that provided vouchers to their staff who could use it to, it could be training or could be a wellbeing activity, but made a real difference to how they felt. So I think some of those smaller things can really help. So thanks very much, Michelle. So good examples and things that need to change. We'll go to Northern Ireland, go to Nicola, and then we'll have a Katie and Kate double header to finish us off on this question. So Nicola.
Sorry, we've got these energy saving lights, so which are great, but they always let you down in the middle. It looks like you're waving at people, but hello. I was scribbling away whenever you were coming up with the question, and there's something around professionalism and being recognised as professionals. The job that we do in the front line, or you do in the front line, is professional, and quite often I think it's not seen as being a professional career. So I think looking at career opportunities and development is really important for me. I attended a Fianza seminar recently on supporting those who support. They've just released a report on that, and Jerry Spillane from Focus Ireland gave a very inspiring presentation. I'm crediting him for this because his focus was really on how employers need to treat staff the way they treat service users in terms of providing that good quality environment, providing the best support they can, the wraparound, doing all of that. So creating a really good work environment, I think, for staff, and making sure that things like reflective practice are built in, making sure that the people's mental health are looked after, and making sure that this is really prioritized and deeply ingrained. But somebody has to pay for this. And it goes back to the point that Michelle was making around the investment. So to me, I quite often refer to investment rather than funding. We need to invest in services so that we can maintain good quality services, treat staff well, and treat our service users and people with lived experience who are in services as well as we can with the resources that are available. So, and basic things like inflationary uplifts to contracts, we don't get that, so we ask for it. Some years we get it, some years we don't get it. Full cost recovery. What I say to our members is, at the end of the day, it is the housing executive or local authorities who have the duty to provide temporary accommodation. It isn't the charity sector. But yeah, we don't have full cost recovery. So I think we need to be making a case to government around that, because fundraising is really challenging for charities at the minute, given the squeeze on people's finances. And as we know, people who usually have less tend to give more. So the people that you're asking, and there's so much competition in the same space for it as well. So I think we need to be looking at full cost recovery. But what Jared Spillane said was staff need to feel safe, supported, and contributing. So whilst there's a lot of people who are doing work with people with lived experience, including ourselves, and listening to the voices. We need to listen to the voices of our staff as well and value that just as much as people who use our services. So it goes back to my point about we're on a journey together. You know, so who are we fighting for, or who are we fighting against? At the end of the day, it's the people that we're here to serve and support. And that's why we do what we do. And I really think there's a hand-in-hand approach here in terms of, as I said, the front line and workers, and also the people with lived experience. They are the people who have most experience. And I think it is about a shared journey and creating those safe spaces and environments to have those conversations, Duncan. So yeah, money and investment on one hand, but also looking at well-being and environments and spaces where people can kind of decompress. That's what I hear. I'm sure you hear it all the time yourselves. It's, you know, how do we decompress? Because so many of frontline workers are doing an incredible job saving lives, literally with naloxone, you know, who walk into a room not knowing maybe there's a suicide risk, there's a suicide, you know, the things that people experience, it's quite incredible. And I don't think, you know, it's similar to a paramedics experience, you know, but I don't think that's really recognized as much as it should be. So I know, for example, we provide not clinical support, it's kind of non-clinical support, but we don't question who gets it. But that costs them, that's a cost to ourselves. But so people should be able to go and get that support when they need it, but also that reflective practice in terms of group work, which I think is really important, because we're all in this together, as I say, you know, so people have very similar experiences, but being able to just shut down and walk away from something at the weekend or whatever it might be, and then pick it up as you come in. That's, you need to be able to be trained to do that. And my concern is that people are walking around with very high stress levels and have experienced really traumatic events, and they're carrying that with them. Now, some employers do it better than others, but I would like to really find out about who's doing it really well so we can learn from that.
Fantastic, Nicola, so much there. I think your point about people being recognised as professionals, that came strongly through the task and finish group, and that value of what you're both for themselves, but also that other sectors recognise the professional expertise and skills. Because as you said, we are like paramedics. Paramedics get out of the car and turn up. We're on the street, or someone walks into our spaces, and we respond to wherever they are at in the whatever issues that they present with. We don't sit there with our risk assessment and say go away like some other services do. I think that's key. I think also your point about treating staff like service users, we rightly listen to lived experience and need to do more of it, and we also listen to organisations, but too often we miss out the bit in the middle, the frontline worker voice and experience, which is what we're passionate about at St Martin's and the Frontline Network. Inflationary uplift, full cost recovery, but that a lot also, it is also just about how people are treated and helped. There's some research from education where if you talk to people in happy schools, they didn't talk about pay, they talked about feeling supported, good management, valued in their jobs. And in unhappy schools, they only talked about pay. They're actually paid the same in both, but the other environments is what makes things make them want to come to work and make them want to engage. So yes, we need to pay more, but we need to value and support and provide that space that people can switch off at the weekend, like you so powerfully said, Nicola. So Kate, bring you in, and then we'll go to Katie. Kate, what should change? Good examples as well. And there was a specific question here about length of contract. How long do people see as long-term contracts? I mean, we'd all love to say 5 to 10 years, but I presume probably 3 years would be a start. But yeah, Kate, interested in your perspective.
I mean, we've already touched on pay, but I do think funding and pay is so integral to what we need. I think it's at the root of a lot of people leaving the sector, that kind of sense of job insecurity. So funding that's longer term, fair, allows fair pay, and allows staff teams to be created kind of healthy teams. Some of the things that Nicola was touching on, that there's the funding to create that I think is really important. But something else that I feel we should have is a actual workforce strategy. Currently, to me, there's lots of piecemeal things that we want to do, and there's nowhere that actually maps out what the sector looks like, what the workforce looks like, what the roles within it are, what the paying conditions are that we think we need, and then can help us get there. We lack that structure, I think, and that will help then shine a light on the value of the sector and the fact that it is actually a place where people can make it a career, and a really, really valuable career. But without the structure, sometimes it feels we're doing it a little bit piecemeal or a bit ad hoc. And that will then allow services to kind of learn from one another. I think we've got that kind of grounding to start off with. Within that, then we could look at pay, we could look at terms and conditions, we could look at how we work, improve the well-being, we look at how we kind of make it accessible, enhance recruitment options, etc., etc. There's so much richness that go into that, but currently there's a real lack of information, and I think that would put us with parity with other sectors. And kind of related to that, and I feel this possibly as an ask of the people on this call, potentially it's within our gift to make things like this happen, but is a communications piece, really shining a light on the value of our workforce and who they are and the difference they make. That will then help draw in new people into the sector, but it will help make those within the sector kind of feel a bit more valued and equal to their peers within the wider health and social care sector or other related sectors. I think if you kind of look at some of the language and narrative around homelessness, as a member of the public, you might assume that homelessness is that person sleeping in a sleeping bag on the streets. And that's a very, as we all know, very narrow view of the complexity and of the situation, but also a very narrow view of the richness of the roles that there are to support people experiencing homelessness. And I think we should demyth that. It's our responsibility to actually shine a light on what the sector does and the variety within it and the variety of careers you could have and the kind of richness behind all of that. Get kind of kids in schools excited about it, the difference that they could make. So yeah, they would be, I guess, my three wishes.
Great suggestions there. Pay, workforce strategy, and make it a role that people think about and want to be. You know, we all see the adverts. Everyone remembers a good teacher, joined social work, even joined the army. And actually, there are many people out there who just wouldn't have thought of homelessness, but wouldn't also know how it can be rewarding, the breadth and range of opportunities, and crucially the difference that they can make. So that's certainly something we should be thinking about. So thank you for that. Katie.
Agree with everyone on the call. Drop mic. I think in answer to a couple of questions that have been raised, yes, we have tried to raise the issue around residents in supported housing who are ready to go back to work, and we've raised it with the DWP. I think everyone probably on this call has, and we will continue to raise it. It is a massive problem because I think it forces people to choose between staying in the security and safety of supported housing and making that step into work. And actually, we should be creating a scenario where they're able to do to embark into work, but with the safety and security of remaining in supported housing without being financially penalised. So it's not something that the DWP has necessarily responded positively to, but we will continue to raise that. And I think with Ed's question, I think we will be fighting for all of the time. And sometimes that's about fighting with, and sometimes that's about fighting against systems. I think in Wales, we have successfully fought with the couple of the ministers that we've had in recent years, and that means making that case to other cabinet members. So we'd make a lot of the noise externally, and the cabinet member that's responsible for housing making that noise internally within cabinet, and us working with them to provide them with the data that they need in order to make those arguments successfully. And then sometimes fighting against the First Minister, which we had to do a year or two ago, but the result of that was getting a 7.8% increase to the housing support grant, which is what we have that replaced the Supporting People programme in Wales, so funds the vast majority of homelessness and housing support services in Wales. So we got a 7.8% increase, and also the direction from the Minister that that was to be used solely to increase frontline worker wages. So, you know, that's an example of where we're both fighting with a member of the government, but also on behalf of frontline workers to change the minds of other people within government. And I think you know, that fighting for is about making the case across government. We can, you know, often convince the person who's responsible for housing, but being able to make the case across other government ministers who'll be making that decision about funding and about you know, programme for government, legislative and policy priorities is really important. And we recently had a joint meeting with the Cabinet Minister for Housing, but also the Minister for Social Partnership, who's got a responsibility within the Welsh Government for fair work and social partnership. And that was all about trying to increase his understanding of the homelessness and housing support workforce, you know, give them an experience, an insight into the experiences that you have on a day-to-day basis, the huge challenges and complexity that you experience, and shine a light on the unequal recognition that you get as a workforce. So sometimes it's you know, working across government, and we do that, you know, across other groups. You know, we're lucky enough to sit not just on housing groups within Welsh Government, but also on, you know, mental health, substance use, social care, and trying to make sure that we're raising the profile of this workforce amongst other ministers and policy officials within those other areas is really, really important, because if we only take the housing sector and the housing minister with us, we're not going to make that much progress. I think in terms of the key things that need to be in place, I think that, you know, strategy, you know, and getting stuff committed in strategy. One of the things that we managed to do was get a valued and resilient workforce in the Ending Homelessness Action Plan and in the outcomes framework, and we had to argue pretty hard for that. But once you get that as an outcome and you get that as an action within strategy, there has to be activity that follows that. So that can seem like just words on the paper, but actually it opens the doors for further action. I think the funding is critical, because, you know, we try to bring local authority commissioners with us, and actually what a lot of the time they say is we'd love to do things differently, but the funding envelope that we get from the Welsh Government is not big enough to enable us to commission the way that we would want. So, you know, trying to join forces with local government and make a kind of coherent argument together about that. I think affecting the commissioning guidance. So we're currently, as part of the Workforce Task and Finish group, making all sorts of recommendations to ministers on things like pay, support systems for staff, training, qualifications and professional recognition, but also about changes to commissioning guidance to make sure that you know, because that's the lever that's going to deliver all of this stuff. You know, it's all well and good saying this is what we want, but if we don't change how the way that services are funded and commissioned, we're not going to achieve that. And from my perspective, it's about taking a holistic perspective. So we know that pay is critical, and that is the real bread and butter issue that will impact on whether you're able to enter or stay in the sector, whether you're able to pay your own bills, or whether you're pushed closer to homelessness as a frontline worker. But the other stuff is really important as well. So trying to make sure that there's psychological support for staff, that there's reflective practice available and a reflective culture more widely within the organisation, as well as training and support to help you deal with the increased complexities that you're facing. So I would always advocate that holistic approach to this issue. And, you know, we're really hopeful that the Workforce Task and Finish group in Wales is making representations and recommendations to ministers on all of those things, and we're very much presenting it as a holistic package rather than just facing on one thing or the other. And I think that reflects the work that's happening in England with Kate and Duncan as well. So you know, I think learning from each other as well, we often do it in legislation, you know, we're like, oh well, Scotland's doing this, so you don't want to get left behind, do you? And I think we've got to take that approach with the workforce stuff as well, and whenever there's something positive happening in another nation, you know, let's use that to motivate ministers here, even if it is just out of a competitive edge. Let's do everything we can to improve the conditions for our workforce.
Brilliant, Katie, and all of you. Loads of great examples there. If anyone wants an example to learn about how to do good lobbying for change, get yourself down to Cymorth Cymru and see Katie and co, because I think everything you said there about it's about funding and what you achieved in the housing support grant and getting that earmarked for workers. It's about being in the strategy, but it's about action and the commissioning guidance and looking at it holistically. And I think those building blocks is really key. But I think also your point at the end about how we can to draw examples from each other and use them to kind of leverage for change in across the 4 nations and in between different local areas. So we've got about 6 or 7 minutes left. So I want to come and to you each for one last time. And I want, in that spirit of thinking of good examples that we can kind of lever for change, I think I'd like you to each suggest something that an example of something you've seen or heard of that someone's doing to improve our workforce well-being and circumstances. Potentially, there may also be something you're doing in your own organisation, because we should practice what we preach. And any thoughts on how we collectively support one another? As Kate said, the theme of this conference is community. So anything about how we can build a community. You don't have to answer all 3, but a positive example of practice that you see, maybe something you're doing in your own organisation, and how we can collectively act for change. So Michelle's come off mic, so I'm going to go to you first. She's raring to go. I'm going to go Michelle, and I'm going to go to Kate after that. Okay, Michelle first.
Thanks, Duncan. Just any opportunity to shout about All In for Change, which includes frontline workers, and it's a team of frontline workers working alongside people with lived experience of homelessness. Hopefully some of you will stick around and hear from them later on this afternoon, but that's one of the only groups or teams that I know that has frontline workers with a direct route to government and direct route into decision making. So that group reports directly to, well, it used to be to the Housing Minister, it's now to the Cabinet Secretary for Housing in the Scottish Government. And it's really, it's just really unique and special, I think. And the frontline workers that we have as part of that team credit it with things like their professional development, their confidence developing, their success and satisfaction at work. So more of that type of thing, I think, would be really excellent.
Brilliant. And also All In for Change is also a partnership as well. Homeless Network Scotland, Cyrenians in Edinburgh, and at St Martin's we provide some of the funding too. So, but yeah, it's a great partnership, and it doesn't cost that much, but it's achieving great, and it's had some longevity too. It's not just one of these initiatives that came and went. So I think a really good example of how we bring together lived and learned and frontline experience. So thank you. Kate, the positive examples and how we can be a community for change. And then I'm going to go to KT, and then I'm going to finish with Nicola. Okay.
So something that I've seen or heard has worked really well is mentoring and reverse mentoring. There's a fabulous mentoring scheme that's happening run by a council in England on the south coast, and the opportunities and the development and the kind of the impact it's having on both, particularly the mentors as well as the mentees, is really powerful. But also there's another service that's doing reverse mentoring, where there's a kind of, in theory, someone who's in theory, quote unquote, less senior is the mentor, and that actually is as powerful. So I do think that kind of touches on both the development of staff, but also that sense of community and collaboration and learning from one another. And I think it would be fabulous if we had a sector-wide mentoring scheme. I don't know how feasible that is, but where you could match up workers from 20 different nations or certainly different services, but that work in similar roles, learn from one another, support one another. So I am a massive advocate of mentoring and reverse mentoring.
Brilliant. We look forward to Homeless Link developing that soon. But I think it would be, I think that, and in the online world, it must be possible for ways to connect and learn our age, experience, different roles, different nations, different parts of the country. We've all got something to share. Thank you. Katie.
Yeah, I think on a national level, our recently published homelessness and social housing allocation bill has been massively influenced by people with lived experience and frontline workers. So we had an expert review panel that took place over a year. And we worked with Frontline Network Wales to submit papers that express frontline workers' views on the current system and what needed to change, as well as engaging with over 300 people with lived experience. And you can see the fingerprints of those people with lived experience and frontline workers over the new legislation, and increasingly as a result of that and some other work we've done with the Frontline Network Wales, Welsh Government are seeing frontline workers as a particular stakeholder group that they want to continue engaging with whenever they're developing policy and legislation. So I think that's been really, really brilliant at a national level, because I think we know chief execs do their best to represent their frontline workforce, but you know, there's nothing like hearing it from frontline workers and the way you tell it. And at a service level, we recently worked with a couple of organisations to develop a reflective practice starter kit, which I'll put in the chat. And I think my reflection was hearing from organisations that had really committed to embedding reflection, not just reflective practice as a process, but reflection as a culture throughout everything they did and influencing all of their processes. And actually that gave the staff in that organisation, despite facing all the very same challenges everyone does, a real sense of worth, value and ability to kind of reflect, look after their own well-being and be the very best that they could be for the people they're supporting. So I think that's a really nice example at a practice level.
Brilliant. Two really important things: direct representation and engagement for frontline workers, and proper reflection, and genuinely listening. Not one of those tokenistic, we really value your view, but we're not really going to do anything with it. Proper reflection, listening and learning. Okay, thank you, Katie. Nicola.
Okay, on a practical level, and this is part of the psychologically informed environment, what Focus Ireland does, and they're operating in the south of Ireland, but they have a critical incident stress management system where within 72 hours of overdoses, death or violent or any other critical incident they have, within 72 hours, they'll have a debriefing session with the staff involved to share and to grieve. And I thought that really struck me. I want to find out more about it, but there was that recognition that you develop relationships. Obviously, we are in a people, business. That's what we're about. People are our business. And you develop relationships and connections with people, and whenever they die or whenever there's a critical incident, staff do need time to grieve and then to move on from that. And so I've just heard about it. I'm going to read into a bit more, and I'm going to meet up with Ger Spillane to find out a bit more about it. In terms of what we're doing in Belfast, there's a Complex Lives project, which is a multidisciplinary project for people who would be chronic homeless, as I refer to it. So mostly people who are on the streets, and it's, as I say, it's multidisciplinary and it's across sectors. And there's a training program that goes with that, which is trauma informed. And I think there's something about training our sector with other people who do similar type work, be it in the police, be it your neighbourhood officers on the street through the council, whether it's drug and addiction, alcohol, our staff in our sector, bringing people together and sharing, learning and developing that culture across sectors is really important. Now, there's no evaluations been done from that, and it's still quite early days with it, but I can see huge benefits. And also, I'm very keen to work with people with lived experience to help train staff as well, so that there's kind of that 360 approach to it. Because there is a lot of burnout, there is a lot of stress, and obviously we do have to listen to the voice of people with lived experience who use services, because there probably are ways that we could do things differently as well, and their voices are very powerful, and government more likely maybe to listen to what they're saying in terms of what needs to change and happen. So that's just a few things, Duncan.
Brilliant. Thank you, Nicola. 3 great suggestions: listening to lived experience, learning alongside other professions what they experience, and that point about debriefing, really key. Issue about people we worked with when they die or pass away or have serious issues, and giving people the space to grieve and reflect is really important. But thank you so much to Nicola, Michelle, Kate and Katie. Had some fantastic contributions. Yes, sharing of the challenges, but lots of positivity and hope. We'll continue to want to be a community. One of the things we're passionate about at St Martin's is that learning across the 4 nations and the different regions within them. We've all got similar circumstances. We can all learn from each other. We can all get competitive and push each other to achieve more and push those who we work with. But thank you very much. Thanks for engagement on the chat and the Q&A. I know there was a specific question about 16, 17-year-olds we haven't come to, but you're right. The Ofsted regulation does bring in new issues which need looking at. Go and grab yourself a cup of tea or coffee, but of course, come back at 11:30 to join the workshops. Thank you for your engagement. Hope we set off the day, because in the end, there's challenges, but we are the sector who takes the most hopeless cases and we turn individuals' lives around, and together we can build the sector that we all want to work in, and that makes the difference that we all want to achieve. So thank you, and see you all later. Thanks very much.